If you think back to your undergraduate nursing education, would you say that you learned more in your lectures, maybe labs, or during your clinical placements? Hello and welcome. Once again, my name is Amanda Haas, and I'm a course-based Master of Nursing student. It's February 28th, 2016, and this is my narrated PowerPoint on virtual simulation as a teaching strategy. Research shows that an overwhelming number of individuals feel that the bulk of their learning is done in application settings, such as clinical. Unfortunately, these opportunities are limited in many centers as various programs are competing for clinical space, such as practical nursing programs, paramedic programs, social work. And here in Regina, we even compete for clinical spots with the U of S campus here. Many programs have implemented simulation labs to augment application-based learning, but these programs are expensive to implement and to run. And they're also highly sought after by different programs and institutions. The learning outcomes for this presentation are simple. I will review with you what is virtual simulation and why is it necessary? What are the benefits and the drawbacks? How is virtual simulation executed? And what existing products are currently available and how do they differ? Most importantly, in conclusion, I'll review how virtual simulation can help you in your current professional role, whether you're an educator, student, working in management, or a floor nurse. Virtual simulation stands to benefit each and every one of you in a creative way. To introduce the problem, one important goal of nursing education is the development of critical thinking. Peck and Miller explain that students entering the workforce are apprehensive about their perceived ability to teach and to reach performance targets related to critical thinking, decision-making, and care delivery. And they often report a lack of self-confidence and anxiety about their competence. McCallum, Ness, and Price state that decision-making is not a skill that is easily explained in a classroom, and that critical thinking skills are generally developed in the workplace with the guidance of a mentor. However, due to limited clinical placement opportunities and the limited access to physical simulation labs and the cost associated with such, nursing educators of today are faced with an opportunity to provide innovative, interactive teaching, learning, and assessment strategies to develop students' clinical decision-making. Nursing educators are challenged to rethink the pedagogical approaches to teaching and learning. Confidence can be described as a student's belief that they can execute necessary skills in the clinical setting. This confidence is a major component of the development of sound clinical decision-making, which is the foundation of being a nurse. The ability to repeatedly perform a skill is directly related to the development of confidence. In the absence of additional clinical time and simulation lab time, virtual simulation can allow for more exposure to realistic clinical skills such as decision-making, psychomotor skills, communication, and critical thinking. This allows for a more flexible, cost-effective learning experience. Newer learning technologies can take advantage of the advanced technical skills of the next generation of learners, many of whom have grown up with computers and the internet. Virtual simulation is an online 3D training environment that can expose students to the challenges of the nursing profession in a safe, engaging, dynamic, and accessible environment. Depending on the product used, it can be multi-person and real-time, or individual and asynchronous, done at the time of the user's choosing. Virtual simulation offers a user-friendly experience designed for health professions and well-suited to authentically replicate a clinical setting. Critical elements to note in regards to virtual simulation are patients, environment, care providers, the scenarios themselves, and of course, the necessary equipment. Virtual patients respond appropriately with pre-programmed verbal and physiological responses, or they can respond interactively with a facilitator modifying vital signs, responses, and general appearance in multi-person scenarios. Multi-patient scenarios can also be used to teach prioritization, distraction, and time management. The virtual environment is appropriate and realistic. It has available monitors, equipment, charts, and more for users to access. Virtual care providers can be registered nurses for individual scenarios, or you can include doctors, nurses, nurse practitioners, family members, support staff roles, consults, etc. in multi-person simulations. These can all be enacted by users of one profession, or they can be used in interprofessional collaboration, where each profession is actually acting as themselves in the simulation. Scenarios are predetermined and reactive. They change according to the action or inaction of users. Appropriate technology is required with reliable internet access and audio equipment for interaction. The benefits of virtual simulation are remarkable. Possibly the most noteworthy is its accessibility. Educators and students have the ability to work on simulations from the comfort of their own homes, offices, or local institutions. In the case of multi-person scenarios, individuals can interact from all over the world in real time. This kind of accessibility is unmatched by many of today's teaching strategies. With individual asynchronous simulations, users can access simulations where and when it is convenient for them, which makes it a viable option for busy students and current registered nurses or professionals who struggle to get away from work for training and continued competency. Virtual simulation offers a safe platform to apply theoretical knowledge, skills, and decision-making without fear of harming a living patient. This helps to bridge the gap between theory and practice. Also, creative and challenging scenarios can be created to provide exposure to situations that would be difficult to replicate in the simulation lab or in a clinical setting in an ethical way. Multi-person scenarios can be arranged between disciplines to encourage interdisciplinary and interprofessional education and collaboration, as users can work through together the care of the patient. Repeated exposure to scenarios and practicing communication and critical decision making fosters increased knowledge and confidence. Perhaps the most important from an administrative perspective is the cost-saving ability. Depending on what product is used, scenarios can be interactive and detailed as the buyer wants, and the costs are reflective of this, but they are still significantly cheaper than clinical time or simulation lab, maintenance and supply replacement, and facilitation. As with any strategy, virtual simulation is also plagued by some pitfalls. The disadvantages include potential issues with users who have decreased computer proficiency, and technical issues may cause delay or inability to log on, connect to the internet, and maintain an internet connection. These issues may be remedied by having an information session and a trial run to work out any issues users may have before an actual simulation is required. It may be an assumption that all individuals will have equal computer skills and experience. The products, however, are very user-friendly and generally simple to use once you've logged on successfully. Student perception and attitude was also raised as an issue in the literature because the patients are not actually real, and they therefore put forth less effort. Educators can also be resistant to new technologies, as many do what they have always done, and it has always worked. Thorough initiation and review of the benefits associated with virtual simulation can help with this, as well as a thorough orientation and practice session before they're expected to interact with students can be helpful. Educators struggle, just like students do, with lack of confidence and perceived competence with new things, and repeated exposure to new skills is equally important to them as it is for students. So some products currently available and that were addressed in the literature that I read were VSIM by Walter Kluers, Shadow Health, which is based out of California, CliniSpace, and Second Life. CliniSpace and Second Life both offer multi-user real-time experience that is very interactive and collaborative. Shadow Health is independent and asynchronous, but users are able to ask questions and receive feedback from the virtual patient. VSIM is what our program currently has access to, and I used it for the first time this semester with my pediatric clinical group in an informal way. It's asynchronous and runs 5 pre-programmed pediatric simulations. It's more of a checklist of things to do format, and after reviewing and reading about all the others, I feel that it's maybe not as good, but it did provide a good supplement to my students' learning. In the clinical environment, we have to work with whatever happens to be admitted, which sometimes leads to a less diversified experience. VSIM allowed me and my students to review different clinical diagnoses and experiences we may not have had exposure to otherwise. To wrap things up and to review, whether you're an educator, manager, clinical nurse, or a student, virtual simulation can offer an interactive, dynamic experience for users with physiological feedback that provides information that helps build confidence, decision-making, and clinical reasoning skills. Can you think of all the ways virtual simulation could help in your own current position? Repeated exposure to clinical situations helps staff and students alike connect the dots between theory and practice and helps them to be confident in their decision-making ability. With multi-person simulations, users have the opportunity to practice communication, delegation, and collaboration. There is currently a push to embrace interprofessional education, IPE, and collaboration in the workforce, and virtual simulation can help to facilitate this process in a cost-effective and innovative way. Virtual simulation can be used for orientation, continued competency, and even remediation. Lou et al. States that insufficient knowledge can be due to a failing of an individual, but it can also be due to a system failure, such as failure of a school or hospital authorities to prepare staff adequately to fulfill their responsibilities. Because clinical practice errors are often linked to miscommunication and lack of education, the use of multi-person virtual simulation can help foster this skill in a safe but challenging environment. I believe that virtual simulation can help fill the theory to practice gap in an efficient and cost-effective way. Please now reflect back on the question I asked at the beginning. How do you best learn? Through lectures, labs, maybe podcasts and PowerPoints, or through application-based experiences, such as clinical and simulation lab. Hopefully now you've begun to see the value, too, of virtual simulation. We have reviewed what virtual simulation is and why it fills a gap in the current nursing education system. We reviewed some of the benefits and drawbacks, as well as the critical elements of virtual simulation. We also briefly reviewed some of the virtual simulation products currently available. But most importantly, we discussed how virtual simulation can benefit you. Thank you for listening to my podcast today. I look forward to watching the rest of them. Have a good day. Here are my references and a few more.